121. A nurse is caring for a patient with severe anxiety. What is the first priority? A. Encourage problem solving. B. Promote deep breathing techniques. C. Provide detailed education. D. Ask the patient to make important decisions. Answer. B. Promote deep breathing techniques. Rationale. Deep breathing helps reduce acute anxiety symptoms. 122. A patient with bipolar disorder is in a depressive episode. What intervention is most helpful? A. Encourage social isolation. B. Promote physical activity and structure. C. Ignore the patient's concerns. D. Increase environmental stimulation. Answer. B. Promote physical activity and structure. Rationale. Routine and activity help manage depressive symptoms. 123. Which of the following is a negative symptom of schizophrenia? A. Hallucinations. B. Delusions. C. Social withdrawal. D. Disorganized speech. Answer. C. Social withdrawal. Rationale. Negative symptoms include social withdrawal, apathy, and lack of motivation. 124. A patient taking risperidone reports dizziness when standing up. What should the nurse do? A. Stop the medication immediately. B. Encourage slow position changes. C. Increase fluid intake. D. Suggest avoiding medication at night. Answer. B. Encourage slow position changes. Rationale. Risperidone can cause orthostatic hypotension. 125. A patient with anorexia nervosa has a BMI of 16. What is the priority nursing intervention? A. Encourage daily exercise. B. Provide nutritional support. C. Discuss weight loss goals. D. Allow unrestricted food choices. Answer. B. Provide nutritional support. Rationale. Restoring nutritional balance is the primary goal. 126. A patient with panic disorder is hyperventilating. What is the best response? A. Try to slow your breathing with me. B. Just stop overreacting. C. Focus on something else and ignore it. D. Panic attacks are not real, calm down. Answer. A. Try to slow your breathing with me. Rationale. Guiding controlled breathing helps reduce symptoms. 127. A patient taking lithium has nausea, vomiting, and tremors. What is the nurse's priority action? A. Administer an antiemetic. B. Check lithium levels. C. Encourage fluid intake. D. Reassure the patient that this is normal. Answer. B. Check lithium levels. Rationale. Symptoms suggest lithium toxicity. 128. A patient with PTSD avoids crowds and refuses to leave home. What is the best intervention? A. Encourage gradual exposure to public places. B. Force the patient into a crowded area. C. Tell the patient to just get over it. D. Ignore the behavior. Answer. A. Encourage gradual exposure to public places. Rationale. Gradual exposure helps desensitize fear responses. 129. A patient with schizophrenia has a flat affect and does not respond to stimuli. What is the best nursing approach? A. Use simple, direct communication. B. Encourage elaborate responses. C. Avoid all interactions. D. Expect immediate changes in behavior. Answer. A. Use simple, direct communication. Rationale. Clear, simple communication is effective for negative symptoms. 130. A patient taking fluoxetine reports increased energy, but still has suicidal thoughts. What is the priority nursing action? A. Increase the medication dose. B. Assess suicide risk and safety. C. Encourage social interactions. D. Tell the patient to ignore the thoughts. Answer. B. Assess suicide risk and safety. Rationale. Increased energy may raise suicide risk and depression. 131. A patient with alcohol use disorder reports hand tremors and nausea. What is the priority intervention? A. Monitor for withdrawal symptoms. B. Offer counseling sessions. C. Encourage a high-sugar diet. D. Provide unlimited fluids. Answer. A. Monitor for withdrawal symptoms. Rationale: alcohol withdrawal can lead to seizures and delirium tremens. 132. A patient with schizophrenia states, I hear voices telling me to hurt myself. What is the priority action? A. Ignore the statement. B. Assess for suicidal risk and safety. C. Tell the patient to ignore the voices. D. Change the subject. Answer: B. Assess for suicidal risk and safety. Rationale: hallucinations commanding self-harm require immediate safety assessment. 133. A patient experiencing a manic episode is pacing nonstop. What should the nurse do? A. Provide high-calorie snacks and fluids. B. Ask the patient to sit down immediately. C. Encourage group discussions. D. Allow unrestricted activity. Answer: A. Provide high-calorie snacks and fluids. Rationale: manic patients burn excess energy and need nutrition. 134. Which patient statement suggests narcissistic personality disorder? A. I always feel empty and afraid of abandonment. B. I deserve special treatment because I'm the best. C. I prefer to be alone and avoid socializing. D. I always think people are out to harm me. Answer: B. I deserve special treatment because I'm the best. Rationale: grandiosity and entitlement are key traits. 135. A patient with dependent personality disorder needs to make a small decision, but refuses. What is the best nursing approach? A. Encourage the patient to make a choice. B. Make the decision for them. C. Allow complete avoidance of decisions. D. Punish the patient for indecisiveness. Answer: A. Encourage the patient to make a choice. Rationale: supporting decision-making fosters independence. 136. A patient on haloperidol develops a rigid posture, fever, and confusion. What is the priority action? A. Administer acetaminophen. B. Stop the medication and notify the provider. C. Encourage hydration. D. Reassure the patient that this is normal. Answer: B. Stop the medication and notify the provider. Rationale: symptoms suggest neuroleptic malignant syndrome, a medical emergency. 137. A patient with social anxiety disorder avoids eye contact and speaks softly. What is the best nursing intervention? A. Encourage gradual social interaction. B. Force the patient into a large group setting. C. Ignore the behavior. D. Discourage communication. Answer: A. Encourage gradual social interaction. Rationale: gradual exposure builds confidence. 138. Which statement by a patient taking benzodiazepines requires further teaching? A. I should avoid alcohol while taking this medication. B. I can stop taking this medication whenever I feel better. C. This medication helps with my anxiety. D. I may feel sleepy after taking this medication. Answer: B. I can stop taking this medication whenever I feel better. Rationale: abrupt discontinuation can cause withdrawal symptoms. 139. A patient with paranoid schizophrenia refuses to eat, stating, the food is poisoned. What is the best response? A. I understand you feel that way, but the food is safe. B. Stop being paranoid and just eat. C. You have to eat or you'll be force-fed. D. Ignore the food and focus on something else. Answer: A. I understand you feel that way, but the food is safe. Rationale: acknowledging concerns while providing reassurance promotes trust. 140. A nurse is evaluating a patient with depression. Which statement suggests improvement? A. I still don't want to get out of bed. B. I have started going for short walks daily. C. I can't concentrate on anything. D. Nothing will ever get better for me. Answer: B. I have started going for short walks daily. Rationale: increased activity and motivation indicate improvement. 141. A nurse is caring for a patient with borderline personality disorder. Which behavior should the nurse expect? A. Difficulty maintaining relationships. B. Consistent mood stability. C. Rigid adherence to rules. D. Lack of emotional reactions. Answer. A. Difficulty maintaining relationships. Rationale. Borderline personality disorder is characterized by unstable relationships and emotions. 142. A patient with major depressive disorder states, "I don't want to live anymore." What is the nurse's priority action? A. Administer the prescribed antidepressant. B. Ask the patient if they have a plan for suicide. C. Provide a distraction to change the subject. D. Encourage the patient to rest and sleep. Answer. B. Ask the patient if they have a plan for suicide. Rationale. Assessing the presence of a suicide plan is critical for safety. 143. A nurse is caring for a patient who is experiencing a panic attack. Which intervention is most effective? A. Encourage the patient to express feelings. B. Stay with the patient and provide reassurance. C. Suggest that the patient take a nap. D. Limit interaction with the patient. Answer. B. Stay with the patient and provide reassurance. Rationale. Being present and offering reassurance helps the patient feel safe during a panic attack. 144. A patient with schizophrenia is prescribed clozapine. What is a priority nursing consideration? A. Monitor for signs of hypotension. B. Monitor for signs of agranulocytosis. C. Encourage increased fluid intake. D. Monitor for signs of dehydration. Answer. B. Monitor for signs of agranulocytosis. Rationale. Clozapine can cause agranulocytosis, a life-threatening condition. 145. A patient with bipolar disorder is experiencing a manic episode. What is the best nursing intervention? A. Encourage physical activity to release energy. B. Provide a quiet, structured environment. C. Increase social interactions with other patients. D. Allow the patient to express all feelings. Answer. B. Provide a quiet, structured environment. Rationale. A structured, calm environment helps prevent overstimulation during mania. 146. Which of the following medications is commonly prescribed for the treatment of generalized anxiety disorder? A. Olanzapine. B. Lorazepam. C. Fluoxetine D. Lithium. Answer. B. Lorazepam. Rationale. Lorazepam, a benzodiazepine, is commonly used to treat anxiety. 147. A patient with alcohol withdrawal is at risk for delirium tremens. Which of the following is a priority nursing intervention? A. Administer prescribed benzodiazepines. B. Encourage hydration with electrolyte solutions. C. Provide a high-calorie, high-protein diet. D. Monitor for signs of hyperglycemia. Answer. A. Administer prescribed benzodiazepines. Rationale. Benzodiazepines reduce the risk of delirium tremens and seizures during alcohol withdrawal. 148. A patient with post-traumatic stress disorder, PTSD, frequently relives a traumatic event. Which of the following should the nurse include in the care plan? A. Encourage the patient to avoid talking about the trauma. B. Provide a quiet environment with minimal stimuli. C. Promote re-exposure to the traumatic event. D. Teach grounding techniques to prevent flashbacks. Answer. D. Teach grounding techniques to prevent flashbacks. Rationale. Grounding techniques help prevent flashbacks and manage PTSD symptoms. 149. A nurse is educating a patient about the use of selective serotonin reuptake inhibitors, SSRIs. Which statement by the patient indicates a need for further teaching? A. It may take a few weeks for the medication to work. B. I should avoid drinking alcohol while taking this medication. C. This medication is addictive, so I can stop anytime. D. I may experience some side effects like nausea initially. Answer. C. This medication is addictive, so I can stop anytime. Rationale. SSRIs are not addictive, and stopping the medication abruptly can cause withdrawal symptoms. 150. A patient with narcissistic personality disorder refuses to share their diagnosis with family members. How should the nurse respond? A. Tell the patient that it is essential for family involvement. B. Respect the patient's wish to keep the diagnosis confidential. C. Insist that the family must be informed for the patient's safety. D. Tell the family about the diagnosis without the patient's consent. Answer. B. Respect the patient's wish to keep the diagnosis confidential. Rationale. The nurse must respect the patient's privacy and autonomy within ethical guidelines. 151. A patient diagnosed with schizophrenia refuses to take their prescribed antipsychotic medication. What is the nurse's priority intervention? A. Discuss the benefits of the medication. B. Respect the patient's decision not to take the medication. C. Administer the medication covertly. D. Ask the patient why they are refusing the medication. Answer. A. Discuss the benefits of the medication. Rationale. Educating the patient on the benefits of medication can help address their concerns and promote compliance. 152. A nurse is caring for a patient with obsessive-compulsive disorder, OCD. Which intervention is most effective in managing the patient's compulsive behaviors? A. Ignore the compulsions to reduce attention to them. B. Encourage the patient to perform the compulsions in private. C. Support the patient in gradually reducing compulsive behaviors. D. Discourage the patient from performing any compulsions. Answer. C. Support the patient in gradually reducing compulsive behaviors. Rationale. Gradual reduction of compulsions is a key part of treating OCD. 153. A patient with a history of self-harm is being admitted to the psychiatric unit. What is the nurse's priority action? A. Ask the patient about their triggers for self-harm. B. Remove any potentially harmful objects from the room. C. Offer emotional support and reassurance. D. Give the patient time alone to calm down. Answer. B. Remove any potentially harmful objects from the room. Rationale. Ensuring a safe environment is the priority to prevent self-harm. 154. A patient with bipolar disorder in a manic phase insists on staying awake for several days. What is the nurse's primary concern? A. The patient's risk of dehydration. B. The patient's risk of injury due to poor judgment. C. The patient's need for medication adjustment. D. The patient's desire for social interaction. Answer. B. The patient's risk of injury due to poor judgment. Rationale. During mania, impaired judgment and impulsivity increase the risk of harm. 155. A nurse is caring for a patient diagnosed with dissociative identity disorder, DID. Which of the following is the most appropriate intervention? A. Reinforce the patient's identity and encourage full integration of personalities. B. Ignore the alternate personalities and focus on the primary identity. C. Provide support to help the patient understand the different personalities. D. Confront the patient's alternate personalities about their behaviors. Answer. C. Provide support to help the patient understand the different personalities. Rationale. Supporting the patient in understanding and managing the different personalities promotes therapeutic progress. 156. A nurse is educating a patient about taking lithium for bipolar disorder. Which statement indicates that the patient understands the instructions? A. I will take my lithium only when I feel manic. B. I should have my lithium levels checked regularly. C. I can stop taking lithium if I feel fine. D. I should avoid drinking plenty of water while on lithium. Answer. B. I should have my lithium levels checked regularly. Rationale. Regular monitoring of lithium levels is essential to avoid toxicity. 157. A patient with schizophrenia is exhibiting delusions of persecution. How should the nurse respond? A. Argue with the patient to challenge the delusion. B. Agree with the delusion to avoid confrontation. C. Acknowledge the delusion and gently redirect the conversation. D. Ignore the delusion to prevent reinforcement. Answer. C. Acknowledge the delusion and gently redirect the conversation. Rationale. Acknowledging the delusion and redirecting helps maintain rapport without reinforcing the false belief. 158. A nurse is teaching a group of patients about assertiveness training. Which of the following is an example of an assertive response? A. I don't want to go, but I'll go anyway. B. I don't like this, but but I'll do it because you want me to. C. I prefer not to, but I can do it if needed. D. I don't want to go, and I'm not going. Answer. D. I don't want to go, and I'm not going. Rationale. An assertive response expresses feelings clearly while respecting personal boundaries. 159. A nurse is caring for a patient diagnosed with obsessive-compulsive disorder, OCD. Which behavior requires intervention? A. The patient performs rituals in private. B. The patient expresses a desire to reduce compulsive behaviors. C. The patient spends significant time performing rituals. D. The patient follows a structured routine to complete daily activities. Answer. C. The patient spends significant time performing rituals. Rationale. Excessive time spent on rituals interferes with daily functioning and requires intervention. 160. A nurse is caring for a patient with a personality disorder who is frequently manipulative and seeks attention. Which action should the nurse take? A. Set clear, consistent boundaries with the patient. B. Ignore the patient's behavior to avoid confrontation. C. Encourage the patient to express their needs in detail. D. Provide frequent attention to avoid escalation. Answer. A. Set clear, consistent boundaries with the patient. Rationale. Establishing boundaries helps manage manipulative behavior and promotes therapeutic interaction.